Top of day, everybody. Another health, home, and lifestyle edition. But this time, we're at the Guam Regional Medical City, where we'll be talking about respiratory care advancement with Dr. Michael Augustine and Dr. Robert Salas, who are part of GRMC's pulmonary department. Doc, really cool respiratory care that you guys have here. But how did it all start?
So everything had started upon the build-up of this hospital. I think one of the things that, again, one of the main uh, things that this hospital would like to actually pursue is actually advancement in subspecialty care. And aside from cardiology, neurosurgery, neurology, neuroscience, surgery, pulmonary had been one of the things that actually had been the very core of this hospital. At that time, we were actually integrating pulmonary with ICU.
Pulmonary with ICU.
Exactly.
Did this happen also as we were fighting the COVID pandemic here?
So at the time, again, we were initially when we started in 2016, we were only looking into having an outpatient pulmonary department. And as we actually go with this, we started to build some subspecialty service within the pulmonary department. One of the things that we have started here in Guam is the build-up of our own pulmonary lab. Bob is actually our respiratory therapist, and he takes care of this pulmonary lab that we have here. We have actually a state-of-the-art pulmonary laboratory, which actually we cater with procedures that are at par with some of the tertiary hospitals, teaching hospitals in this in the mainland U.S. We have our own pulmonary function test, asthma testing, cardiopulmonary exercise test, and a lot more of testing that we do actually in-house for this. After that, we actually ventured into other primary diseases of the lungs. All right. So again, I think understanding the four important diseases that plague the island would actually would help us understand and why we built this center here at GRMC. One would be smoking-related disease. That is again one of the bulk of patients that we see. That's where Bob, actually, in his pulmonary lab, we screen all these patients and we do all the testing to see the severity of smoking-related disease. The other two important things would be the acute diseases, not only COVID. Right? We've seen a lot of patients being admitted because of pneumonia, asthma, COPD, and that's where the team of Greg Cruz and the whole respiratory team come into play, that they take care of the patient here and at least bridge them so that they can get discharged. Okay, the third one would be chronic debilitating disease, in which we actually have our pulmonary rehabilitation that could continue their care when they get out of the hospital. And the last important component of diseases that plague Guam is lung cancer. And again, over the past 3 years, that's where we actually put so much emphasis in diagnostic and also treatment for lung cancer.
Thank you for that, Dr. Mike.
Yeah.
Mr. Salas, of course, you're a key player in this department, but I just like to ask how big of a role do you play in helping treat patients?
Well, number wise, we're really busy as far as testing goes. There's not a day goes that we have any downtime. So there's a big need for the testing to go on. With the testing comes diagnosis. From there, we're looking at the right pathway, how to treat the person the right way. And I'm just thankful that it's a multidisciplinary approach. We have respiratory, we have rehab, we have cardio, and everyone gives a little bit, but a lot, just for the patient's care. And I'm a respiratory therapist, by the way.
So, just to wrap everything up, when you guys work with your patients and help them get better, what are usually their main concerns?
One of the main concern of the patients, because again, we cater on adult care. One of them is how far they could actually get out of the work. Again, these are debilitating diseases. If you're short of breath, you can't work. If you're short of breath, you can't attend to family. And this is where we actually come into play to give them prompt diagnosis and treatment. But there are other things that would be more of an advanced diagnostic and treatment, such as, for example, lung cancer or a severe infection, where the hospital actually played an important role, where people get in, if they're really sick, get diagnosed and treated here in the hospital. At the same time, we can transition them better when they get out of the hospital. So I think this is more of trying to understand, again, what are the things that the patient can miss in terms of work, in terms of family, when we try to treat them. And the sooner we can diagnose them, the sooner we could treat them, the sooner they can get back to their baseline.
Mr. Salas, would you like to add on to that?
No, I mean, I'm just happy that we have this capacity right now in Guam, just to help people, the way that we do here.
All right, that's super great. You guys always do a good job here. Lastly, any message to those who may feel like they have a little tightness in their lungs but don't want to seek medical care?
So the good thing about it, for the past few years, Guam had already advanced their capacity of diagnostics and treatment, that people don't need to go off island for this basic and also for this subspecialty care. I think going to your primary care is important. Your primary care, again, we communicate with them on a regular basis, and we would cater for every respiratory need here in the island. In the same way that at least, again, we could discuss your illness with your family. That's important for you, and not only you, but also your family would understand what type of respiratory illness that you have, and we could work together in treating and making you back to your baseline health.
All right, well, that is just one key player in respiratory care advancement here at GRMC. Don't go anywhere. More Health, Home, and Lifestyle when we come back.